Hello everybody, my name is Heather Brown. I'm a registered nurse and instructor at Gurnick Academy of Medical Arts. This chapter that we're covering for our fundamentals course is chapter 17, Infection Prevention and Control in the Hospital as well as the Home. So this chapter 17 material will appear on your fundamentals midterm exam. So there's no specific quiz on this content. This is a midterm test topic. Everything that you learn up until midterm is testable, and this specific chapter doesn't have a quiz, so you'll just see this content on your midterm. So let's go ahead and get started with today's lecture. Here's our first of several introduction slides. So lesson 17.1, infection prevention and control. So everything here pertains to theory, what we're going to be learning theory-wise. So point 1 here, we're going to learn to describe the stages of infection. Number 2, we're going to learn how to list 2 common healthcare associated infections, or HAIs, and describe 3 ways to decrease the occurrence of each. Point 3, we're going to learn to explain how transmission-based precautions are used with standard precautions. Point 4, we're going to learn to compare and contrast airborne precautions with droplet precautions. And number 5, we're going to learn to discuss the special requirements for airborne precautions when the patient has pulmonary tuberculosis. Here's an introduction slide on lesson 17.1, infection prevention and control. So this slide covers what we're going to be focusing in on for theory. So we're going to learn to compare infection prevention and control procedures appropriate for the hospital with those used in the home. We're also going to be able to list techniques for handling specimens, disposing of soiled linens, trash, and sharps, and cleaning equipment in the isolation setting. Next, we're going to learn to give 3 examples of how the nurse can provide psychosocial care of a patient in isolation. And point 9, we're going to learn to state the 4 rules of surgical asepsis. Here's our last introduction slide, but this one focuses in on our clinical practice, what we're going to be learning about. So point 1, we're going to learn about how to use standard precautions when caring for a patient. Number 2, how to utilize transmission-based precautions when caring for patients. Point 3, how to properly bag and remove soiled linens and trash from an isolation room. Point 4, we're going to learn how to teach a patient or family member how to properly dispose of soiled items at home. And lastly, point 5, we're going to learn how to teach a patient or family member proper hand hygiene techniques. We're going to start by looking at infection. So there's 4 stages in the infectious process. So infectious disease can spread before the symptoms of the disease are fully recognized. So the 4 stages, so let's start stage 1 is the incubation period. This begins when the organism first enters the body and lasts until the onset of symptoms. Infection can be transmitted during this stage. So this is when it first enters and lasts until the symptoms begin. Stage 2 is the prodromal period. This is a short time from onset of vague symptoms to the onset of specific disease symptoms. This stage is highly infectious. So at this time, a patient might have vague symptoms like GI discomfort or a small rash, something very vague that could be a million other things, until it gets to very specific disease symptoms. Stage 3, this is the illness period. So they can have localized and systemic symptoms, fever, headache, malaise, that's just generally not feeling well, and disease-specific symptoms like leukocytosis, perhaps a rash, swelling, wound drainage, diarrhea, and vomiting. Some of these symptoms can appear. Severity and duration depend on virulence of the pathogen and person's susceptibility. And stage 4, this is the convalescent period. It begins when symptoms begin to subside and continues until the person returns to normal. So these are the 4 stages of infection. Healthcare associated infections, or HAIs. So I'm just going to give you some information just to illustrate what a problem this is. Not something for you to memorize, just to illustrate. So the CDC estimates that HAIs just in hospitals cause at least 2 million infections, 90,000 deaths, and 4.5 billion in healthcare costs annually. So super big problem, these HAIs. So once again, those numbers aren't to be memorized, just to illustrate the severity of the problem. So these are transmitted while receiving healthcare services. Healthcare workers can also contract an HAI. So this list includes patients at greatest risk. So they're patients with surgical incisions, with or without drains, artificial airways, so our ventilated patients, patients with urinary catheters, IV lines, implanted prosthetic devices, like if somebody gets a new hip or a new knee, that's an implanted prosthetic device. Patients with repeated injections or venipunctures, and also our patients that their immune system is compromised. So this is a list of our patients that would be at greatest risk for an HAI. So it is important that you're able to identify the patient that would be at the greatest risk for an HAI based upon these risk factors. So be able to understand this list and apply this list to potential questions. So the most effective part of infection control to reduce these is the use of proper hand hygiene before and after caring for any patient. We also want to make sure that we're doing hand hygiene before putting on gloves and after removing gloves. So this is the most effective thing that we can do as healthcare providers to prevent an HIA is this great hand hygiene before and after seeing our patients, before and after putting on or removing gloves. Infection prevention and control. So with isolation, emphasis is placed on containing microorganisms and preventing their spread. So infection prevention and control uses medical and surgical asepsis, which we're going to go into, as well as standard precautions and transmission-based precautions, all things that we'll be covering, as well as strict aseptic technique. Aseptic technique is used in invasive diagnostic and therapeutic procedures like IV catheters, urinary catheters, and surgical procedures. We'll also talk about strict aseptic technique and how this is useful. Isolation is used to prevent contact between patient and others. Others can be visitors or healthcare providers. I do want to point you to the direction of the health promotion and health promotion points on page 244. So this specific section covers different things that the patient can do to help prevent infection. Some of these things are very basic seeming, like coughing and deep breathing every 2 hours. So this would be used to prevent a complication of, say, a hip replacement. Patient's got a hip replacement, they're not getting up very often, they're at risk for pneumonia as they lie in bed for extended periods of time. So a very simple nursing intervention is to instruct the patient to turn, cough, and deep breathe every 2 hours. So that's, we've talked about in the past how sometimes the interventions aren't really that exciting. So it's not like we see on TV where we're always doing these very dramatic interventions. Sometimes it's just simple instructions. Sometimes it's something simple in a task to do infection prevention, like making sure that we wipe patients in the correct direction, that we're going not from the rectum to the urinary meatus, but the opposite direction. We always want to cleanse from the urinary meatus towards the rectum. This helps prevent the risk of infecting the urinary tract. So this box covers many, many important points, and I do want you to be sure that you tune into that page there. Infection prevention and control continued. So infection prevention and control involves monitoring diagnostic reports related to infection, observing patients for signs of infections, implementing procedures to contain microorganisms. Remember, implementing is like when we actively do something. Properly handling, sterilizing, or disposing of contaminated items. Using approved sanitation methods. And recognizing individuals at high risk for infection and implementing appropriate protection. So remember I pointed out that specific place. This chapter has a lot of extra boxes to review. Make sure that you're tuning into them because we do want to be able to recognize individuals at high risk for infection and then make sure we know how to protect them. Current standards for infection control. So current standards have changed drastically in the last 30 years, so it's ever evolving. You'll see in your nursing career that things always continue to change. So things have changed for the last 30 years and they will just keep on changing. So tier one is when we utilize standard precautions. This is what we should always utilize, standard precautions. This is where we avoid direct contact with body secretions except for sweat. Tier 2 is transmission-based precautions. So this is dependent on how something is transmitted, we use those precautions. That's what transmission-based precautions means. Interrupting the mode of transmission by identifying specific secretions that might be infective. So this is very specific based on a transmission process. Transmission-based precautions used alone or in combination, but always in addition to standard precautions. Remember, we always utilize standard precautions. We just might be utilizing other precautions in addition to that. Here are transmission-based precautions. So at the top, we see standard precautions. Remember, I say we utilize these for all patients. They're standard. We always do them. What we can do is we can refer to box 17-1 on transmission-based precaution requirements. So tune into that box because this slide is very important. It's also the basis of a lot of our lecture for this content. So tune in there. Also pay special attention to the information here. So we have standard precautions used for all patients. Then we have airborne precautions. So some patients that are placed on airborne precaution examples include patients with measles, varicella, as well as TB. These are some examples. For TB, those patients need to use a special particulate filtered mask called an N95. You can see a picture of that in your book. So those TB patients have that special mask. The next type of precaution is droplet precaution. Potential patients placed on droplet precaution include patients with meningitis, or patients with pneumonia, or diphtheria. With droplet precautions, we always want to make sure that we wear a mask if we're within 3 feet of the patient. So there's that 3 feet wear a mask rule. And then next we have contact precautions. So contact precautions, this can include GI, skin, wound infections, RSV, or herpes. So basically if we come in contact with a secretion or a wound from one of those systems, for example, then we would want to make sure that we utilize contact precaution for those different things. So once again, box 17-1, you can see in closer detail. Make sure that you're able to see the big things as far as what are the special things we'd want to pay attention to, like our N95 masks, our droplet precaution rules, what patients we utilize standard precautions on. Personal protective equipment, or PPE. So there's a couple skills for you to review on PPE, how to put it on and how to remove it. I will mention that briefly in this slide, but that's mainly a skills lab area. But PPE, we want to never touch with bare hands anything that contains fluids from a body surface or cavity. So we never want to use our bare hands. Anytime we're seeing fluids, we want to make sure that we're wearing gloves. Gloves are to be worn for contact with body fluids of any sort, including saliva, urine, feces, or blood. So if it's moist and it's from the body, we need to use gloves. The only time gloves are not worn is for contact with intact skin or unsoiled, okay, not moist, unsoiled articles. So at those times, we could avoid wearing gloves. Now, just to reference Skills Lab, there is a skill on putting on PPE. The basic order is the gown, then the mask or respirator, then the goggles or face shield, and finally the gloves. But to remove it, the sequence would be gloves first, followed by the face or goggles, the face shield or goggles, and then the gown, and then finally the mask or respirator. So those skills are in the book. That's just a very quick review. And then when to wear gloves and when not to, definitely covered in this slide. Application of the nursing process. So we've learned about the nursing process before. Now we're trying to apply it to our current topic. We're trying to pull in previous processes we've learned and now apply it to current information we're learning about. So assessment, our data collection time period. This is where we'd want to assess for signs of infection that may require transmission-based precaution. So depending on our patient's signs, they might require special precautions. Wounds should be assessed each shift for infection. Never let a shift end without seeing a patient's wound. If they have a wound and it's something that can be assessed, make sure that you assess it. In the past, we've mentioned if it's a patient right out of surgery, then the surgeon will take off that first dressing. But if it's a wound that can be assessed, make sure by the end of your shift that you've assessed it. We always want to monitor the patient's temperature, so looking for a fever. Admission lab studies may indicate infection, so things like an initial white blood cell count. That's a very common lab done upon admission, and a high WBC count could indicate infection and further assessment. So those are all different data collection assessment items when it comes to infection. Potential nursing diagnosis would be risk for infection. That could be potentially related to a surgical wound, an open wound, or weakened condition. So that's one potential nursing diagnosis. Risk for infection, possibly it could be related to surgical wound, open wound, or weakened condition. Planning. This is another part of the nursing process. Expected outcomes, what we expect to happen for our patients, would include no healthcare associated infection is evident. So we would expect that we would not give our patient one of those HAIs. And then next, when using transmission-based precautions, so think back to the transmission of the mask needed or the special N95 mask. So when using these transmission-based precautions that require that PPE that we ran through, the nurse must prepare before each entry into the patient's room. So we talked about putting on the PPE and removing the PPE. So it's very important that the nurse has everything ready before they enter that isolation room. If they were to forget something, they'd have to take off all the PPE, wash their hands, exit the room, and then get whatever it is that they were missing and repeat all those steps again. So when it comes to planning for these patients, the nurse wants to make sure that they're ready and have everything that the patient needs. Implementation, this is the doing. So patient teaching is needed on disease process, modes of transmission, and precautions to prevent spread of infection. So we always want to make sure that we're educating patients on why we're doing the things we're doing, what disease process they might have that's requiring that specific precaution. Remember that standard precautions, they're standard. They're used for each and every patient that we take care of. Implementation continued. So hand hygiene. This is the most important thing you can do to prevent infection transmission. Hand hygiene, it seems so basic, but it is going to be a big test answer at Gurnick and at your NCLEX is hand hygiene. Super basic, super important, because it's the most important thing that we can do to prevent infection transmission. So we want to wash our hands before and after contact with patient, wound care or invasive procedure. And we always want to wash our hands before donning or putting on gloves, as well as after removing them. So sometimes I see nurses think that the gloves are super protective. If they wear gloves all day, hand hygiene is never needed. But remember, hand hygiene is always needed before putting on gloves, as well as after they're removed. So gloves aren't a way to get out of hand hygiene. It's in addition to hand hygiene. So very important point is hand hygiene. General guidelines for isolation precautions. The first guideline we're going to go over is specimen preparation and transportation. So we want to label the specimen container before entering the room. We want to collect the specimen and place it in a leak-proof container without contaminating the inside. So this is specimen preparation and collection. So if a nurse is collecting a specimen, we always want to make sure that we send that specimen to the lab in a biohazard bag with the requisition, which a requisition is what's telling the lab what needs to be ran on that. It's the doctor's order of what needs to occur. And we want to make sure that that lab sample in that bag has that requisition in it as well. So that's specimen preparation and transportation. Remember, label that specimen container before you go into the room, because once you come out, you're not going to want to touch it. Soiled linens. So we always want to wear gloves when collecting those specimens that we talked about. And when it comes to handling contaminated linens, we want to roll and hold our linens arm length away from the body. So we don't want to hold them close to our body, because whatever is on that bed is now on you, and it's eventually going to be on your next patient. So we want to roll and hold those linens at an arm's length away from the body. We want to deposit all contaminated items in isolation containers within the patient's room. So if our patient's on isolation, we don't bring those linens out, because what we're doing is we're transmitting that patient's infection throughout the hallway. So for our isolation patients, we really want to make sure that we're utilizing the container inside our patient's room. For our standard precaution patients, we also want to make sure that we're not walking those linens up the hall and that we're bringing over a linen cart, so we're reducing the risk of infection for our other patients. So it is important that you know how to handle soiled linens. And if it was an isolation precaution patient and they did require for you to wear a gown, you'd want to make sure that you wear a gown for that. Always want to make sure that you have gloves on. And you'd want to roll those sheets together and place them in the designated container inside the patient's room. So some key points here on how we prepare a specimen, as well as how we want to handle soiled linens. More general guidelines for isolation precautions here. So the next one is trash and how we handle biohazard waste. Disposable soiled equipment should be placed in plastic bags lining the waste receptacle, and a biohazard or red bag may be needed. So red bags are needed when we're taking care of things with blood on it, things with a lot of drainage. This is a time that we'd want to utilize a biohazard or red bag. A lot of times people just say, do you have a red bag? That is a biohazard bag that they're requesting for. The next part is sharps. So sharps, this is important. This is a big safety hazard. Remember, NCLEX is going to test you on if you're safe. So safety is key. We never recap a needle before disposal. We never recap. So all sharps are dropped into the sharps container. We're not going to ever stick our fingers in there for any reason. I don't care what's dropped in there. You don't put your fingers in there. So in those sharps container, we want to make sure that they're replaced when they're 2/3 full. Although you might not ever stick your finger in it, if we fill them up too high, we're leaving it where somebody else could try to get into that sharps container. So we want to always replace them when they're 2/3 full. If a family member has to take care of their sharps at home, they want to place their syringe and needle without recapping it in a large plastic bottle with a secure lid to keep themselves safe. So if it was the home environment, we could utilize a plastic bottle with a secure lid for that patient. More general guidelines for isolation precautions here. So we're going to start with other equipment. Reusable equipment is cleaned if visibly soiled, then sent to central supply to be disinfected. So if it's reusable, meaning if it's an IV pump, we're not going to throw away an IV pump. But what we're going to do is we're going to clean it if it's visibly soiled, and then we're going to send it to central supply, who's going to properly disinfect it. Faucets, that's other equipment in the patient's room. They should be turned off using dry paper towel to protect the hands from recontamination. Natural defenses institute measures to enhance the patient's natural body defenses, such as protect intact skin, promote a balanced diet, provide opportunity for sleep, and decrease stress. So these are things that enhance the patient's natural body defense. So we want our patients as well as possible. More general guidelines for isolation precautions here. So patient placement. Patients who need transmission precautions should be placed in a private room or with another patient infected with the same organism. So say if somebody had E. coli in their urine and their roommate had E. coli in their urine, then we could potentially room those two patients together. They require the same isolation, they have the same organism. If that's not possible, then the patient needs to be placed in a room by themselves. When it comes to transporting the patient, we want to avoid unless absolutely necessary. So we wouldn't want that patient with tuberculosis leaving the room unless it was absolutely necessary. Patient is given a standard mask to wear outside of the room. So that's when we have to transport that isolation patient. Now we're moving to infection prevention and control, but the focus here is in the home environment. So this is our infection control patients in their own homes. They want to make sure that they keep their clothing and linens away from others until they've been washed. We want to be sure to teach our patient, as well as their family members, proper hand hygiene techniques. Remember, we focused on hand hygiene and how it's the best thing that you can do to protect your patients. We also want to make sure that we're educating our families about this. Those patients in their homes can disinfect their bathrooms with a 1 to 10 bleach to water solution. And lastly, when it comes to washing dishes, they need to be using scalding hot water and allowing them to let them air dry. Same topic here, guys, continued. So our patients want to use heavy plastic jug with secure top to hold needles, which we discussed a few slides ago. They want to be sure to use clean gloves for wound care or dressing changes, and teach the family how to remove soiled gloves. So that's something that you learn very early in Skills Lab. It's in your book. We want to be able to teach our family members how to do that. Next, they need to dispose of soiled dressings and wound care supplies in a plain, unlabeled plastic bag that are tied up securely. So let me repeat that. They want to dispose of soiled dressings and wound care supplies in a plain, unlabeled plastic bag that's tied up securely. And they want to make sure that they're keeping their room clean and sanitary. Protective environment. So this would be used for a patient who is immunocompromised. So for a patient with a weakened immune system, it is very important to protect him or her from exposure to potential pathogens. So that's what they mean here by protective isolation. So we're protecting them by putting them in isolation. So a patient in a special room with its own ventilating system. No one with active infection is allowed in the patient's room. So if somebody had an infection, they wouldn't be able to go in and see that immunocompromised patient. And we want to make sure that we remain aware of the facility's policy and procedure regarding protective isolation and follow them at all times. So whatever the facility's policy and procedure is what you want to make sure that you're following. Psychological aspects of isolation. So unfortunately, with the world we're living in today and everything that's happening, this might kind of be something that you can connect with. So the patient in transmission-based isolation, like we talked about, those droplet precautions or other precautions, is at risk for decreased self-esteem and sensory deprivation. So signs of this would be the patient's very bored, perhaps their thought process is slower, their thoughts are disorganized, maybe sleeping too much during the day, anxiety, hallucinations, and maybe even in extreme cases, panic attacks. So our patients might have one, several of these different signs, depending. So let's think about what the nurse can do to help prevent these types of problems. So a couple chapter goes, we talked about listening to the patient. So that's one of the big things that the nurse can do is just listen to the patient's feelings, hear them. We want to make sure that we're trying to make positive comments on what the patient's trying to do. Like if our patient is staying active in their room, make positive comments about that. We want to always try to engage our patient into meaningful conversation by asking them about their interests and hobbies. If they're having visitors, we want to make those visitors feel welcome. So we want to welcome visitors if possible and help them understand that the patient benefits greatly from their presence. So if visitors are there, us as nurses, we want to say, that's awesome, welcome, and let them know how beneficial it is for the patient. Infection prevention and control for the nurse. OSHA regulations protect healthcare workers from exposure to blood-borne pathogens in the workplace. So there's three main modes of occupational exposure to blood-borne pathogens. So number one, these are puncture wounds. Puncture wounds from contaminated needles or other sharps. That's why we do not recap our needles. The second mode is skin contact. This is done by allowing blood or body fluids and other potentially infectious materials to enter through damaged or broken skin. Remember, if it's moist, we want to make sure we're utilizing gloves and always washing our hands. And the third mode here is mucous membrane contact, allowing infectious materials to enter through the mucous membranes of the eyes, mouth, and nose. That's why we want to be very conscious that we're not touching our faces after coming in contact with our patients. Surgical asepsis. This is our sterile process. So there's 4 rules of surgical asepsis. Rule number 1, know what is sterile. Rule number 2, know what is not sterile. Rule number 3, we always want to keep our sterile items separate from our unsterile items. And then most importantly, if a contamination occurs, we want to make sure that we remedy it. So it doesn't matter who you're working with. If it's a doctor, a registered nurse, an LVN, we want to make sure whoever we're watching, or if we're even performing it, if there's a break in this sterile process, that we start new, that we would create a new sterile field if there was a possibility of contamination. Remember, the patient is the person at risk. So if we think that we might have broken this sterile process, we want to make sure we start anew. The goal is always to keep an area free from microorganisms. Surgical scrub. This is more lengthy and vigorous than regular hand hygiene. It's meant to remove as many microorganisms as possible without damaging the skin. Timing is based on actual time spent scrubbing, not including rinse time, so it's actual scrub time, not rinse time. Usually lasts from 2 to 4 minutes. Brushless technique with antimicrobial agent may be used. And hands cannot go below the elbow during the surgical scrub. So the hands cannot go below the elbow during the surgical scrub. Opening sterile packages. So before we do, we want to make sure we perform hand hygiene. We always want to open the sterile package away. So keyword away from the body, not towards, but away from the body. We want to touch only the outside of the wrapper. We never want to reach across the sterile field. We always want to face the sterile field and allow at least 6 inches between the body and the sterile field. So for more details here, you want to review skill 17.3, opening sterile packs and preparing a sterile field, as well as step 17.1, how we pour sterile liquids. So I put these review here so you guys can tune in, pay special attention to these skills. So remember, if that sterile field becomes contaminated, you always want to make sure to start a new one. If you're adding sterile liquids, if you do something like you make that sterile field wet, you want to start a new one. So pay attention special to this skill here listed on this slide and spend a little time making sure that you're familiar with this. The evaluation phase. So patients recovering without additional instances of infection from other organisms or infection of other body areas. So we basically want our patients to recover from what they have without getting anything else. We also want to assess whether the patient's infection has been transmitted to any healthcare worker or any other patient on the unit or in the hospital. Remember that infection prevention and control is the responsibility of every single nurse. Review question number 1. During which stage of infection would a patient be irritable, be fatigued, experience malaise, have an elevated temperature, and be considered highly infectious? Go ahead and read those answers, then we'll cover. All right, guys, so this was very early on in the lecture, but the answer here is number 2, the prodromal period. So the rationale is the prodromal period is the onset of vague symptoms. Often the patient doesn't even know he or she is sick, and they are highly infectious. So the answer here is the prodromal period number 2. Review question number 2. Mary is taking care of a patient with tuberculosis or TB. What specific type of precautions should Mary take? So think back to those precautions that we covered. We went over some specifics. We also talked about how important that information was. Go ahead and think about this, then we'll review. All right, guys, so for this TB patient, we want to utilize number 2, airborne precautions. So in addition to standard precautions, which are used for all patients, airborne precautions are used with patients with TB because transmission of the disease is airborne. So answer here is 2, airborne precautions. Review question number 3. When taking care of a known tuberculosis patient or TB patient, the nurse must wear. So the answer here is 3. The nurse must wear a special mask, that particulate filter mask or N95, must be worn when caring for patients with airborne transmitted diseases. Review question number 4. When opening a sterile package, a nurse should do all of the following steps. So everything except. Go ahead and read. So the nurse would want to do everything except number 1. So moisture will contaminate the sterile field and supplies. Anything below the waist level is considered contaminated. Washing hands, obtaining equipment, and opening packages away from you, as well as lifting the front flap up and towards you, these are all appropriate things. So 2, 3, and 4, these are appropriate. Number 1 is what we'd want to avoid, and so that's our correct answer, number 1. So thank you guys all for listening in. I hope you're well. Have a great day.